Thank you very much. Thank you very much. Good morning. I'll get that out right. So we're going to jump right in. And when I talk about this issue, a couple things. I want to talk about a couple of key players. Because if you know about them, it helps you frame where they're coming from and why. And then we're going to tell you what the one thing I need you to do through the route this year and probably into next year. First, a couple of players, the president, all right? One thing that he loves this in all of his personal and what I call professional relationships. That's he loves leverage. He loves leverage in everything he does. So when we're talking about some of these issues, what I want you to think about is who is he trying to leverage and why? So if you think about that, that's kind of the direct path. That's how he thinks. I'm not going to be able to tell you a story how I met him 15 years ago and got to spend a little bit of time. He'll deny the story. But I got real insights to how this guy really thinks and how he operates in a very, very direct way. The second person is the new Health and Human Services Secretary, RFK Jr. Now, the one thing you really need to know about him is he made his millions being a personal injury attorney, a personal injury attorney. And that's how he approaches life. That's how he's wrote his books. It's all been from these examples. So again, that's how he approaches many of the issues that come to the fore. It's unique, it's different. It's even unique to have a lawyer, not to at HHS, running the show. So those two things are really, the one thing I want you to do in this, and we'll kind of hammer this point home, if a proposal to ban prescription drugs comes out, what I want you to do is keep doing what you're doing. Don't stop. Don't stop believing. Don't cut ad buys. Don't let your clients run and cower. Because if you become co-opted, that's their strongest card. That's what the president loves to do. So if you see something, no, don't back off immediately. Tell your clients not to, and no, we'll have your back. And I'll talk about that and why you haven't seen an ad ban to date. So, first coming up, what we saw during the presidential campaign is RFK was a candidate, and he said basically on the first day in office he was going to issue an executive order to ban pharmaceutical advertising on television. He doubled down in some rallies on that point, and then just before the elections he said, Trump in the White House, me back in DC so we can ban pharmaceutical advertising. It was backed up in that tweet, do they still call it a tweet? By a guy named Elon, and then the FCC chair, Brendan Carr. Want to talk to you about what happened shortly after the election. Now, I've been in DC for a while, and so I have a lot of friends there. And I got a call from a friend on the day before Thanksgiving. He said, Jim, I'm working the transition. I'm not going to be part of this administration, but you need to know we're lining up all the political promises and we're dedicating teams to come up with solutions for them. And I immediately thought, oh, I know what's going on. I said, you're going to overload the box, aren't you? Nothing. Chirping, nothing on the other end. I go, okay, I got it. What does that mean? In the last 2 years of the first Trump administration, he did 200 executive orders. So I said, aha, he's going to do it again. He's going to line up all these campaign promises, and he's going to overload the box in the first couple months with executive orders. So, what's an executive order? Why is it different? An executive order is a glorified press release that directs an agency to do something that the president wants. Whether it's legal or not, he directs them. So that's what this was about. And moving it forward, it takes some time to implement that for the agency, so it's at least 30 days. So when an announcement comes out, executive order, don't immediately panic because it's got to be implemented by a federal agency. If you're doing like immigration, okay, it's INS, ICE that has to kind of do those things. They got to develop a plan, they got to move forward to do something like that. You've heard of another. We'll talk about some others that, you know, again, it takes a little bit of time, so don't immediately panic when you see it. The policies that you've kind of seen come forward related to this, Bernie Sanders, and I think a House bill was just introduced equivalent to this, is end prescription drug ads now. And you can see by the definition, this is broad. So my friend told me, he says, you're high on the list. Okay, we got an executive order, kind of yes, I got that. And he said, if you think it's just television, think again. Those are the two things he told me. And so it turned out to be reality. So I've seen a lot of people go, oh, we got the perfect answer. They're going to take out linear, and you're going to move into these other venues, and I got the perfect solution for you. They're selling a product. They don't have a clue about policy. So don't believe any of that. Don't believe any of the blow out there that says, I got the great solution for the ad ban, because they don't know. These are, they're going to be comprehensive. That bill has 5 co-sponsors. It hasn't moved. It's going to be a really tough climb to get moving. The next thing is we've seen some state bills. So you look at the Oklahoma bill. I think Bernie, actually, his staff developed it off this bill. And it's broad, and they had some help in doing this. This legislator has no real background in healthcare, but he knew to add that unbranded prescription drug ads would be exempted. Ooh, we got to have insider knowledge to know that. So a couple similar bills in Texas and Connecticut. None of these bills have moved, haven't had a hearing, and that's going to be a common theme that we kind of go on here. So when we started to dive in, immediately I kind of looked at all the Supreme Court precedents, and I found that there's a whole series of rulings on this since the 70s, and the court has said that essentially advertising is commercial speech protected by the First Amendment. And that's important. You're going to hear that theme kind of come up again. They, by 1980, came up with a central Hudson test, and it really does 3 things. If you want to limit or ban advertising, one, it has to be misleading. That's the basis of FDA law and regulations. If it's misleading, it's out. Second, banning directly advances a substantial government interest. So think about tobacco advertising. That's the closest example. But if you really look at the court cases, you really dig into this, it's mostly a voluntary pullback by that industry. Again, I'm going to repeat it. It's mostly a voluntary pullback from that industry. All right? Third, and this frames a lot of the laws that have come forward for the last 45 years and the FDA laws and rulemaking, that the government's interest could be advanced through a less restrictive route, such as adding a special label, fair balance between benefits and risks. The other thing you have to know is last summer, Supreme Court essentially overruled what they called the Chevron deference. And this allows agencies to interpret what Congress meant by a law. So they said, nope, can't do that anymore. You've gotten a little too wild, a little too liberal. And so now if this is going forward, if a rule comes out, it pretty much has to adhere to that congressional language. If it doesn't, it's going to be more easily challenged in court. So that's an important precedent here. And so it makes rulemakings really difficult now for agencies to do well. So I'm going to talk about the congressional legislative history real quick here. First, there's only one law that's really passed that's impacted healthcare advertising in the last 45 years, and it's this FDA amendments of 2007. And that introduced the concept in the, quote, major statement of risk in a clear, conspicuous, and neutral manner, or CCN. That's really important. If you don't know about this, you need to know about this. We're going to talk about how that was implemented shortly. The other, for the last 45, really 25 years, there have been a series of bills. One, to ban advertising on new drugs for 3 years. The second, to remove the tax deduction. We'll talk about that. And the third, to include a price reference in all drug ads. All these bills have come up. None of them have got hearings. None of them have got votes. Usually, most of the one that at the end has 8 co-sponsors. That's the most co-sponsors that any of these bills have ever had. So they've been out there. They're kind of threats, but they haven't moved. There's not consensus on any of these things. They really can't get 2 parties together. And remember, when parties had majorities in the 90s and aughts, good majorities, they didn't move then. They're not moving now. Second, I'm going to really kind of fly through the FDA regulatory history. In the 60s here, we had two things going. This is really the two things happened. This is what FDA got its laws. This is the first regulations that applied only to physicians. And basically, it couldn't be misleading information. Through the 80s, something really different. This is the concept of joint decision-making really came into vogue. What it really was is folks after the greatest generation who would salute smartly and say, "Thank you, doctor, can I have another?" They moved on to say, I want to learn more about my treatment. I want to become more a part of that. So the radical 60s, these are people getting into middle age and say, no, I want to take a little bit more control of my decision-making. And that really started to impact the way people thought about, coming at, and the marketing of drugs and devices really kind of came into vogue. And in the mid-80s, FDA said, okay, finally, we're going to take the same rules that we apply to physicians, and we think that they're sufficient for consumers. And so for the next 10 years, what you saw is a lot of print ads, because you had to add all the contraindications, all the risk in very, very fine print. And so it was mostly still directed at physicians. The only ads that you saw on television were the reminder and the unbranded ads started to kind of surface during that period. What happened in the 90s? What happened? What was the big phenomenon in the 90s that really kind of changed the world? Anybody? It's bigger than that. The internet. People go, oh yeah, the internet. That's when it really came into vogue. It was created and it really came to be substantial. And it really changed how the FDA looked, because they looked at and said, you know what, we can get this information, all this detailed information. You can get a click away now. You can go get that information, so it doesn't need to be part of that ad. By 2004, they really shortened what needed to be in the brief's summary. By 2010, this proposed rule on CCN finally came forward, 2010. Next couple things, 2019, this is important. Well, when was 2019? Oh, the first Trump administration. What did they try to do? They tried to put a price reference through an HHS rule, this kind of obscure HHS, citation that they used. And even the agency admitted that, yeah, this wasn't very strong. So they liked it, and it was immediately blocked in the courts. And what does that do when it gets blocked in the courts? It takes it off the table for the administration. It takes it off the table for politicians. They can't really talk about it. They'll go, yeah, got beat in the courts, shut up about that. And that's exactly what happened about this issue. You didn't hear about it for the next 5 years. It's only starting to reemerge. So the other big things that what really happened is the CCN really started to get implemented in 2003 and just was effective November of last year. So that's a long time. That's over 15 years that it took from being passed by a bill to a final rule. So it was tricky, but it's an important thing. There is interest, particularly in the Senate, to take the CCN rule and apply it to all digital mediums. And that's very important. And FDA said, yes, thank you, senators, we'd love to do that, but we don't have the authority. And so they've been issuing a series of what they call untitled letters. These are warning, non-warning letters saying, okay, and you've probably seen some of these where they've been social media ads that only talked about the benefits. And FDA said, yeah, no soup for you. We don't like that, and don't do that anymore. And we're going to talk about that as we kind of move forward and why it's important for your clients to know this. And if they're doing omni-channel campaigns going forward, you want to apply the CCN, because we think that there's actually going to be a hearing either this fall or next spring in the Senate, and they're going to line up these people who got these untitled letters or anybody else from here, and they're going to go, hey, Mr. Drug Company CEO, why do you think it's good for Americans to be hoodwinked when you present it this way on television and you present it this way different? Why are you lying to us? You don't want your boss's boss to be up there answering that question. So we recommend, and I'll reinforce this, we recommend applying the CCN rules across all digital mediums at this time, unless you want your boss's boss to be up in the Senate hearing. I get that. It'd be lots of good attention, not good attention, but attention. Okay, talk about our ad ban strategy that we implemented. And we said, okay, I need to get out in front of this. I need to frame this issue with this information that I imparted to you. So that's what we wanted to say, yeah, doing an ad ban won't be easily accomplished. And so what happened? We have done this year 35 media interviews. And you can see some of the headlines from the New York Times and Wired basically picked up our message. And if you get any story, most stories will now say, you know, this ad ban is going to be blocked in the courts. So the media has picked it up. And not only that, I will tell you a story of a briefing that I've done, and I've done, this will be my, I'm counting this as a national conference. This will be my 8th one. I've done a dozen of these. On January 5th, I did one for a broadcasting company. And it went 90 minutes, and they're peppering me with questions. I'm giving kind of the same presentation on, you know, on everything. They're peppering me, and I go, oh, this is not going well. After 90 minutes, close out, and there's applause. I go, ooh. Okay, and they go, you need to know that our evening programs, 40% of our revenue comes from pharma-related marketing. I went like, they go, that would kill us. And I go, wow, they're telling me that, they're mentioning this, so this is important. And then they said, can we have your presentation? I said, sure. And I'm pretty sure that this broadcasting company back-channeled this information, and you can guess who it is, they're my new best friends. Back-channel this information to the administration. So it set the stage. What we also did is we gathered a lot of broadcasters. And so that's the bottom line. It's not only pharma, but broadcasters would be brought to their knees if they banned DTC advertising. Because on average, any news program, about 25 to 30% of their revenues come from pharma. So that's the big target. That's who I think Trump really wanted to go after. Yeah, he wants to put pressure on pharma, that's true, but it was really broadcasters. So we got them together, and we've done a couple of things. We essentially have formed a legal effort where we have now outlined a complaint and a temporary restraining order. So bottom line is, if you see something come out, we're going to sue them. Oh, and it's like, okay, bring it, you know. Part of me wants this to happen, part of me doesn't want it to happen, you know, because I'm really confident we're going to win. We're going to have to spend some money, and I've gotten a bunch of money pledged to fight this thing. But I think that's the political calculus. And they go, do we want to continue to talk about this and just kind of have it out there, or do we want to get it blocked in the courts and then we can't talk about it? So I kind of think that the lawyers are telling them, yeah, let this go, continue to talk about it, because you're only going to get beaten in the courts. The other thing is, when you're under attack, and I learned this through my career, is you have to be able to define who you are, why you're doing it, why you love doing it, and you know what your end means. In this case, how does it help patients improve health outcomes? How does it improve joint decision making? So with my board, we came up with, and you can click on, show up your camera under this QR code. We came up with 14 points. It's a factoid. And then we've got the best research we can to kind of give citations to it. I've used this campaign technique very effectively. Remember breast cancer? It was a mess in the early, mid-90s. And we used this to get all the groups together to pass legislation, regulations, everything else. I did the same thing for infant hearing screening, which is the #1 congenital birth defect. Not many people know about it, but we literally raised through Congress about $3 million to put these programs in so babies screen before they leave. And so we've taken the average age of detection from 3 years to less than 1 month, average age of cochlear implants from 5 years to 9 months on average. And so that's how you. And the final thing, I was up in New Hampshire for the last 10 years, and there's a reason New Hampshire doesn't have a marijuana law, because we got all these groups together and we did the same technique, and the moms pull out these talking points, and they go out there, and legislatures are scared to death of these moms when they get up and start talking about this. Don't you allow this, don't you give this to my children. And so it really works. Bottom line is, if you can get your constituents, if you can get your stakeholders to repeat the same things again and again, if you get about 60% of them, you win hands down. That's exactly what the MAHA movement is about. Keep repeating the same stuff, whether it's real or not, again and again and again. So you have to have that counterbalance to be it. Starts with you. Doesn't have to be over the top. This is stuff, some of these points are stuff that is going to be part of every pitch you make. Everything that you're involved with, they're going to be parts of these things. Here's a couple examples. I went backwards, I'm sorry. Here's a factoid, not many people. So Bernie comes and says, we're going to save billions in lower costs on drug ads. No, CBO says, no, it's going to be 0.1% to 1% on the average price of drugs if you did a ban. That's it. So it's a drop of water. And that's why probably they're not also going on. It's like, it doesn't really have an impact except to maybe leverage some of the players. Another thing is all the great work that we've done to take diseases, disorders that have a lot of stigma and essentially paint a different picture. I know this, I went in front of the NFL and the Players Union, and we pitched them supporting breast cancer. And I remember I almost got in trouble for this, but I was very direct, and I go, okay, you guys got to get behind this, because they were kind of questioning, why do we want to do this? And I go, okay, guys. And it was pretty much guys there. I go, everybody loves breast. Babies love breasts, women love breasts, men love breasts. You got to save breasts. That was it. That was the compelling argument. And that's why the NFL, you see the NFL wearing pink for the first time. So these are the kind of strategies that we can celebrate. We should be talking more about. This is the good work that we do. Okay, update on the admin. In his testimony in mid-May, RFK Jr. said that advertising is commercial speech protected by the First Amendment. My jaw dropped. I went, oh, thank you for just articulating our number one talking point. He got it from a MAHA report that was released a week later that said the exact same thing. So I went, oh, okay, they've got our presentation. They've got our talking points. Great. FDA Commissioner Macri said, we don't have any plans to ban DTC advertising. He says, but there are some things that we can do to make sure that information being presented is a complete picture. And we kind of go back to an early subject. So, things you have to know is it's not in the tax bill, nothing in the tax bill about this. RFK is still looking for a solution, but his options are very limited. And if he does, it's probably going to be a mistake. So, we're in a good position. Our challenge, when I said, I talked to our stakeholders, I said, we need to get past April 1st. And I kind of go, why? We need to get past April 1st, not have an executive order, because my prediction, like in the first administration, they'll have a lot of cases that they're going to have to dispute in court. Right now, there's 260 cases in federal court on all of the executive orders. There's less than 200 executive orders, there's 260 cases. And both the Justice Department and the Office of Solicitor General that hears the Supreme Court, their teams have been decimated by 50 to 60%. So they don't have the lawyers to do it. So I kind of figure this is going to happen. If we get then adding another shrimp on the Barbie is not an easy thing and not something that they want to do. So that's really the strategy. That's where we got. Now we're almost into August, nothing yet. So clearly we were successful in our strategy to prevent an executive order. An executive order to come, we would just have to spend the money to fight it in court and be prepared. And so those first couple months, and what I've heard from a couple of people in the audience who came up to me in the last couple of days and said, I heard you in March. And we had clients that were ready to jump ship. Said, thank you for your presentation. I took that and I gave it to them and it calmed them down. And so hopefully that's what this is doing for you a little bit. And the last thing we say, follow the CCN in these omni-channel kind of campaigns. You don't want your boss's boss to be testifying why you're doing different things and trying to hoodwink the American public. So we're going to fly through the next couple issues here. Advertising deductibility, been something on the books since the creation of the corporate and income taxes since 1913. However, to even amortize that over 5 to 10 years, it's a big ticket item, $83 to $177 billion. We equate that to pharma, it's 3 to 7. But there's a proxy war going between PBMs and pharma, and they're spending millions in advertising. Good for advertising in the DC area, but they're trying to gig each other. So, 2 things you need to know. We're a member of the TAC, and the TAC basically says that there's information of the economic and the, not only that, but the number of people employed in a congressional district or a state or anything like this. And we sat down in front of the tax writing committees in May. I took my board and we talked to them, and they said 2 things. It's too complex to do. 3, if we identify any sector, and that had been the rumor, oh, they're going to go after pharma advertising, just ban that, deductibility for that. They said, if we identify one sector, all sectors become targets. And he says, we'll have the small business people outside our door in minutes with pitchforks. They're ready to string us up if we do something like that. Couple quick issues. This is the one issue that I think is going to impact, and you're going to see it probably by the end of the month, national security tariffs. What this is essentially, there's a lot of precedents and a lot of law that says, yeah, we can protect us against essentially threats from foreign governments. And you heard this kind of circulate during the pandemic, and you saw the breaks in some of the supply chains. And so now they're saying we're going to apply the same thing that we've done for steel and to automakers and defense industry. We're now going to apply to pharmaceuticals and computer chips. And the execs, pharma companies believe it because they're basically ponying up voluntarily $214 billion. I want to say, was it Bristol Myers Squibb? Somebody just yesterday came up and said, yeah, we're going to up our bid another $2 billion. And so I really think that this is happening. You'll probably at the end of the month see either a report or a notice for a proposed rulemaking or a proposed rulemaking. The Commerce Department is going to want to do this by Hoyle. They don't want this to fail. And so this is where the one thing. Bottom line, and I've talked to a lot of industry lobbyists, and they said, we're probably going to have a written waiver. So thank you for your pledge. But we're going to keep your feet to the fire, and it'll be written and saying, okay, if you don't adhere to this pledge, get these things done in the next 3 years, 4 years, then, no suit for you, quadruple tariffs on you, 800% tariffs on you, something like that. So be aware of this. This is real. This is probably really going to happen, and this is important. This is probably the one thing that's going to stick. The next thing that scares a lot of people is right now it's the most favored nation drug pricing proposal. This is not new, but it has a big price tag and a big impact. CBO says at least 5%. Other estimates are high as 15% on the average price of drugs. So it means 25 to 30% cut in brand drugs if this is implemented, because it's comparing it to like a European nation's basically negotiated low price for a brand name drug. So this could have an impact. The big thing that you need to know, it's been tried multiple administrations, Obama, Trump won, Biden said, no, we're not going to do this. We're going to just do Medicare price negotiations. We don't want to get involved. But there's really not law to back this up. If they really wanted it to happen, it would have been in the tax bill, and it would have been a huge tax savings. They chose to pass on that. And I think that's a big hurdle for Congress. So they really don't have the laws. That's why you haven't seen, I think a rule was supposed to come out like 45 days ago. Seen nothing. So again, the calculus is, do we get to talk about this and put verbal pressure on the down person, or do we put it out there, it gets challenged in the courts, and it's gone? So that's the really big thing. Last thing is, I call this lions, tigers, and bears, so this is the attacks, on universities. Again, don't be like Columbia, who keeps kind of negotiating into this death spiral of negotiating with the administration, renegotiation. Don't do that, because you don't get out. Other things, FDA layoffs, that's going forward. There's still a court case, though, on that. Again, a lot of other proposals, ACIP, you've heard all about these things. Again, these are kind of proposals that keep everybody off kilter, to keep them kind of, going and not worrying about, what Mr. Trump did with a guy named Jeffrey, 20 years ago. All right. So this is a summary kind of the tax bill. Again, the things across the top there are not included, even PBM reforms, which everybody thought until the last minute was there. You kind of know or heard about these things, the orphan rare disease drugs being expanded. And that's not till 28, but it's a good thing for the industry. Research and development is the big thing. So they're taking off the amortization that they put on in 2017 for 5 years or 15 years if it's foreign. That's gone. And a lot of people told me, hey, dude, Pharma will sell advertising soul on this. And I was like, yeah, no, didn't happen. All right, that's the presentation. I hope you enjoy your SALT tax cut break of now up to $40,000. Most of us are kind of in that middle income bracket. Happy if we have a couple minutes to take any questions that you might have.
Hello, hi. Jim, awesome. I gushed with you Tuesday. Oh, Jason Whitmer from Simon Media. You helped dispel what you see in the headlines with actual data and policy to folks who often don't read behind the headlines. What I find really helpful here is when you talk about precedent and the legality and the practicality to ban pharmaceutical advertising, you'd have to display that there's a detriment to the public health, like they did for tobacco. Now, you talk about how Trump, he might want to do this to hurt broadcasting, and that's all in the news, right? But RFK says he wants to do that because of the detriment to the public health. Is there actual data that shows that pharmaceutical advertising has any sense to that? Because what I would argue is that, if anything, it makes Americans more knowledgeable and more engaged to be informed in their medical decision. And so that's the benefit to what we're doing. Would you agree with that, or is there any data that supports
great pitch.
Otherwise?
And you see that icon flash up your phones. That's the information that you need. Now there's anecdotal information of, it presses, patients for more brand name drugs, but there's not really good studies. But in the vacuum, what do you hear? It's like, it's bad, pharma bad, pharma bad, pharma bad. It's an annoyance. Well, annoyance is protected by the First Amendment. That's the bottom line here. So that's why you have to take something like this and be able to fire back and say, no, that's not true. The reality is it helps with adherence, compliance. There's a whole host of things that we do to help patient behavior to impact better health outcomes, to help joint decision making. There is another thing. IPG Media Brands and Deep Intent, there she is, hello, good morning, did a study in October. And one of the things, they surveyed 1,000 physicians. One of the big things is, back in the aughts, the data that everyone would talk about is, they would say, physicians really don't like this. They say only 30 to 40% of physicians like or think that advertising in healthcare is worthwhile and helps them. New study says it's now in the mid-90s. So physician attitudes have changed. AMA hasn't changed. They're kind of troglodytes. I used to work with them. They take a long time to process things. But that's the kind of information. We had a board meeting on Wednesday, and my board says, we need to start getting new research in here to kind of update this and reframe these discussions. And that's really what we have to be about as an industry. It's like, how can we put together really sound scientific information to support what we do, what we love to do, and why it's good for the American public? Great question, thank you.
Hi, Brooks with IQM, and our roots are political, so very interesting, and I know we've talked a little bit about it. But just, this is great information, and we seem like to be in a pretty good place here. With the reductions to the FDA, is that a good thing or a bad thing?
No, it's a great question. And so those employees that were fired back in January, February, the Supreme Court said, you can finally go ahead, and they were officially let go last Thursday. So the federal government's been paying them their full salaries, all the benefits, and then they have another 30 days to go on the benefits. But Yes, it's going to have an impact. Those people haven't been in the office, so there are parts of the FDA, like OPDP, has been decimated. All they have left, and I'm sure they've reorganized a little bit, they only have about a half dozen reviewers, to take on your submissions and whatnot. They don't have anybody else. They don't have lawyers. They don't have people supporting them. So the problem is, at some point, do they get overwhelmed? Does FDA get overwhelmed in just drug submissions? And the answer is, yeah, maybe it might happen if we kind of continue on the same pace. The stopper is President Trump doesn't like disruptions in the stock market. He responds very quickly. So if things aren't ticking along at FDA and it hits stock prices, he gets alarmed. And he'll say, okay, reverse engines, go this way. So yes, they could have, across many different federal agencies and healthcare, could have detrimental impacts. We'll have to see long-term. They'll start rehiring at some point. There's kind of dual purposes, and this is where kind of Elon and the president got at cross purposes. Elon just wanted to cut, a lot of money out of the federal government, save all of our souls. And the president wants to do that only if it benefits him. So he really doesn't care. Remember, president doesn't like policy that much. He really doesn't. He doesn't even like doing the national security briefings. It doesn't interest him. He knows. So he doesn't have to do these things. So policy, there's no kind of, oh, this is where the administration's going. This is how they're thinking about things. No, we're going to be all over the map. And so any good concerted effort that kind of pushes back, particularly the stock market or things that he cares about, Trump's friends, and then I go back to my new best friends, he'll listen to those people. So that's kind of the roadmap for lobbyists, is like, can we find those people that can kind of push back and say, oh, we're your friend and they're hurting us with your policy. Any other questions? Been a great audience. Thank you very much. I
All
appreciate
right,
your time.
thank you, Jim.